Hi, my name is Vanessa Villalobos, and today I'm going to be presenting about the reality of major mood disorders. Major mood disorders are defined as any of several psychological disorders, including major depressive disorder or bipolar disorder, and are categorized by abnormalities of one's emotional state. A couple other examples of major mood disorders include major depressive disorder, bipolar disorder, cyclothymic disorder, and dysthymia. More specifically, today I'm going to be looking at bipolar disorder, defining it, and discussing what it means for an individual to have bipolar disorder. The most simple way to define bipolar disorder is a mental disorder that is characterized by periods of elation and then periods of depression. This graph shows the differences in mood range between somebody who has bipolar disorder and somebody who does not. As you can see, the person with bipolar disorder has much more severe peaks and divots in their graph, whereas the person without bipolar disorder has a much more steady, regular change between depression and elation. Bipolar disorder can be broken down into two subcategories, where there's bipolar 1 and bipolar 2. Bipolar 1 is categorized by very severe mood changes between mania and depression, where mania is defined as the period of time when an individual with bipolar experiences elevated energy, irritable moods, irrational thinking, racing thoughts, and other exaggerated behaviors. Now, bipolar 2 is categorized by a less severe mood elevation to something called hypomania, and that will alternate with periods of severe depression as well. And hypomania is defined as the period of time that somebody with bipolar 2 disorder experiences the same symptoms as mania, but they're far less severe. Now, this graph is a depiction of the differences between bipolar 1 and bipolar 2. In bipolar 1, you can see the patient goes all the way up to mania in their peaks and spends a very large majority of their time in severe depression. Whereas somebody with bipolar 2 disorder has a peak only in hypomania and does spend time in severe depression, but substantially less than somebody that has bipolar 1. There are several different causes for bipolar disorder, and some of the psychological causes include childhood trauma, verbal, physical, or sexual abuse, extreme loss, periods of extremely high stress, or different forms of drug abuse. Now, genetically speaking, there are predispositions for people to have bipolar if they have bipolar already in their family. So, somebody is more likely to have bipolar disorder if they have a parent with bipolar or if they have a sibling that has bipolar disorder. As far as treatment, there are medicinal and non medicinal methods to treat bipolar disorder, and the majority of people will need a combination of both. As far as psychological treatments go, there are support groups, cognitive behavioral therapy, psychoeducation, family therapy, and psychotherapy. So, cognitive behavioral therapy is defined as a type of psychotherapy in which negative patterns of thought about the self and the world are changed in order to alter unwanted behavior patterns or mood treatment disorders such as depression. So, this will help because CBT can help a person with bipolar disorder recognize the warning signs of a mood change and help them to learn to change the unhealthy patterns of behaviors when they recognize that they're about to experience a mood change. Now, psychoeducation is a means of providing people that are being treated for a mental condition with information about the causes, the symptoms, the prognosis, and the treatment of their diagnosed condition. If you engage in psychoeducation as a learner, you can find out not only what to expect, but you can also learn what to do and how to improve your condition. And this is also proven to help the family members that are involved with somebody going through a medical treatment as well. Psychotherapy is a very effective way to help people with a broad variety of different mental illnesses and emotional difficulties. Psychotherapy is used to help eliminate or control troubling symptoms so that a person can function better in society and they can increase their overall well being and they can start to heal. And this form of therapy is also more commonly referred to as talk therapy. As far as medicinal treatment goes, there are a couple different forms of medicine, one being an antipsychotic, and some of these are going to include Zyprexa, Seroquel, Risperdal, Abilify, Geodon, and Clorazol. So now antipsychotic major tranquilizers are a class of medication that are primarily used to manage psychosis, primarily in either schizophrenia or bipolar disorder. Obviously, in this case, it is used to manage bipolar disorder. These prescribed antipsychotics are generally also paired with a mood stabilizer. Some of these mood stabilizers include lithium, valproic acid, Tegretol, Neurontics, Topamax, Trileptal, and Lamictal. The technical definition of a mood stabilizer is a psychiatric drug that is used to treat mood disorders that are categorized by intense and sustained mood shifts, typically bipolar disorder type 1 or type 2, borderline personality disorder, and schizoaffective disorder. In layman's terms, mood stabilizers are basically a drug that help to control the peaks and divots in someone with bipolar disorder's mood. And that is all I have today about major mood disorders, more specifically bipolar disorder. This is a list of all the resources I use to find my information. Thank you very much for watching and have a very nice day.